Margaret the Ceann Corla. Obviously, I want to agree with everybody that the response to this, for all of us as individuals and our own personal hygiene, responsibility of how we conduct ourselves is crucial. If I start coughing, please don't panic. I don't want a national panic on telly, just TD coughing, but I do have a cold. But I do think what we should be discussing here is the overall response of the state to this very serious crisis. And I'm sorry, but I do believe that in the public eye, and indeed at the briefing we had this morning, I think the HSE are downplaying the seriousness of the lack of capacity to deal with a huge rise in the need to deal with this virus and its spread. Because anybody who has had reason to go to an A&E in the last 6 months has the experience of being in a war zone, and it doesn't convince the public by just trotting out, self-isolate, stay at home, and given small statistics about the number of beds increased, 12 here and 22 there, that will help to deal with the capacity of it. I think we need a much more thorough explanation for the public. I think also something they're doing in Britain would be very useful, and that's the testing of existing patients in our hospitals who have chronic lung problems to make sure that they don't also carry the virus. Something I raised this morning at the briefing was the level of adequate supply of hand sanitation in schools, and didn't get a satisfactory answer. There was no knowledge of it, except to say that children are better off washing their hands than using sanitation. But in many schools, as we know, there isn't an adequate supply of hot water or paper towels to dry them in, and drying them in hand towels is a no-no. I agree with Deputy MacDonald about the question of cross-border cooperation. It's in a national situation like this that you realise how farcical and unworkable partition is, and that we do need an all-Ireland health service with an all-Ireland response. I want to raise the question of intellectual property rights. We were told this morning that a company called Gilead, who have a base in Cork, ironically that name is also the name of the spooky medieval country in The Handmaid's Tale, but Gilead apparently are developing an antiviral drug. Now, the question of intellectual property rights is really important, because in privatisation of medicine and of cures, intellectual property rights can be held onto by a company without being shared to the public services, to the people who work in our public services, who have the knowledge and the experience of dealing with antiviral medication. And I think that we need to have a move away from that, and that should be a global discussion, that nobody should hog the intellectual property rights of an antiviral drug that may find a cure for COVID-19. I wrote to you, Minister, or Caretaker Minister, about the pharmaceutical industry. Lloyd's Pharmacy, notoriously anti-union but widespread branches across the city, particularly in working class areas, have almost doubled the price of hand sanitation lotion. And many people have phoned me or emailed me and complained about this. And I've asked you, and I asked again this morning, what the government would intend to do about this. Can you intervene? Can you stop that exploitation of never waste a good crisis happening for profiteering? And if not, at the very least, issue a public condemnation of profiteering from this crisis. And again, I agree with the ending of the access to two-tier medicine. But on the workers' rights issue, I think we are now exposed in this country as weak and often providing non-existent protection for workers. We know already how poor workers' rights are in relation to the rest of the European Union, but it is a decrepit system, and the statutory rights of workers were actually changed in 2013 by a Labour Fine Gael government, when the 3-day period of having no sick pay was extended effectively to a week. Now, if you listen to what Boris Johnson is doing, and he's already acknowledged that the first week everybody will be paid from day one if they have to self-isolate, it's a bit of a stretch, but it does make him look a bit like James Connolly compared to what this government are doing in terms of workers' rights. We've heard nothing about it. We've seen correspondence from the ICTU to IBEC. We've seen pronouncements from the WRC which state there is no obligation to sick pay, and where companies don't have a sick pay scheme, there is no obligation for them to provide it. And I think it beggars belief that we are not recognising the needs of workers, particularly low-paid workers and workers in the gig economy, to having a basic living income if they have to self-isolate. Because what will happen is there'll be a reluctance to acknowledge, I have symptoms, I need to stay at home. Because poorer workers, workers on low pay, not only depend week by week on the money they get, but often day by day. We don't. There are many people out there who don't, but we need to recognise that there are hundreds of thousands of workers do. And this state needs to intervene and pass emergency legislation that allows sick pay from day one, that increases that sick pay to a living wage, and that passes legislation to say that, if necessary, employers have to be faced with an extra levy or an extra taxation to pay that. We cannot allow workers not to be able to self-isolate where they need. This is not just a workers' issue, it's a public health issue. So I hope that immediately we can move to introduce legislation on that basis.